Welcome to AUA Leadership in Business, an official podcast of the American Urological Association.
Welcome to the AUA Leadership in Business podcast, where urologic professionals experience the practical application of business acumen essential to successfully navigating today's rapidly changing business environment. I am Dr. Micheal Darson, and in today's episode, we will discuss management styles. Joining me today for this discussion is Dr. Ken Berger. Dr. Berger is the current chair of the AUA Institute for Leadership and Business Education Committee. He is the immediate past president of the Washington State Urology Society, urology lead for Washington State University School of Medicine, and the chief of surgery at Tri-State Health in Clarkson, Washington. Welcome, Dr. Berger, to the podcast.
Thank you. It's good to be here again.
Well, let's go ahead and get started. Let's talk about management styles. What are the different management and leadership styles?
There are a lot of different management styles, and various people categorize them differently. They're anywhere between 4 and 7 to 10 different styles that people use. But I think it's helpful to break them down into smaller categories or groups. One of them is an authoritative style, which is more one-sided in favor of the employer. There's a democratic style, which is more collaborative. There's a laissez-faire style, which is one-sided in favor of the employees. There's a bureaucratic style, which relies on rules and policies and standard procedures. And then there's a transformational style, which is really used by creative teams that encourages innovation and adaptability. But we can break these categories down further. So within the autocratic style, there's an authoritative style, which really is the employer telling employees how it's going to go. There's really not a give and take, and it expects employees to do what they're told to do. It requires constant teaching and coaching, and it's very one-sided. Another type of autocratic management style is a persuasive style, where the manager still makes the decisions, but convinces the employees that it's the right thing to do. Then there's a paternalistic style, where the manager makes all the decisions. Sometimes this can be thought of as condescending or paternalistic, father-like management style. You may listen to the employees, but you're still going to tell them what to do in the end. These are in contrast to the democratic styles, which are more give and take. There's a consultative style, where you put a lot of trust in your employees and you actively seek out your employees' opinions. There's a participative style, where you trust the employees completely and you really there's more of a give and take, and you actually look for their opinions. There's a collaborative style, where you communicate extensively with the employees and make joint decisions. Any questions so far?
No, that's very interesting. Dr. Berger, of those two that we've talked about so far, which do you think are used most often in medicine?
I think they're both used. I think they're both used frequently, and I think that really is very dependent upon the type of practice that a person has and their own management style. I think it also depends on the employees, because there's some employees that really want to be heard, and there's some that really would prefer to not help make decisions and just take direction. I think the autocratic methods seem to have a slightly negative connotation, but I don't think we should look at them that way. I mean, I think that they may be appropriate in the right settings, but I think more people than not probably use the democratic methods.
Yeah, I think also it obviously depends a lot on your practice environment, private practice, academics, employee environment. So yeah, please continue with the other types of styles.
So there's a laissez-faire style, which is more one-sided in favor of the employees, where you just let them do what they do. And there's a bureaucratic style, and to me, this sounds more like HR departments, where you rely on rules, policies, and standard operating procedures to make decisions, rather than on a leader's vision or personality. And then there's a transformational style, which is used more among creative teams. And it helps to create a culture that encourages adaptability and innovation. But each of these styles can be broken down into subcategories too.
Very interesting. So what are the pros and cons of each of these?
Well, the pros of an authoritative style are that you can make fast decisions because the decisions are coming from one person or a management team and they're filtering down to employees. A democratic style really helps empower the employees because they feel a part of the decision making, but because you're consulting more people, it's slower to make decisions.
Okay. How does that contrast with the other forms?
So laissez-faire, with laissez-faire, you're letting the employees make their decisions. You put a lot of trust in the employees and you are more hands-off in your management style. And a bureaucratic style purely relies on precedent and policies and standard operating procedures. Doesn't ask questions of anybody.
Interesting. It seems like, again, going back to your practice setting, at times you may want to tap into each type of management style. So that leads me to my next question. What is your management style?
Well, my management style, it's really changed over the years. I've been practicing for about 20 years. And when I first started practicing, I was definitely more of an autocratic manager. I thought that things had to go one way and I would tell people what I wanted. I was not very collaborative. But as I became more comfortable with with my abilities in both practicing and managing, I became more comfortable with letting people make their own decisions and knowing that if they made a mistake, we could always change things and adjust. So over time, I've really become much more of a democratic manager, and I do really value employees' input and decisions, and I try to make it a more collaborative team.
So let's take a couple scenarios. So say we're thinking about giving advice to some of the residents coming out, and they're going to go into a private practice. What would be your advice on how to develop their management skills or styles?
So again, depending on the type of practice that you go into, you may or may not have people that you're managing. I think bigger practices already have managers, and you actually may be more of an employee being managed. But for those people who are lucky enough to be able to have a team to manage, I think that every organization has its own personality, and some lend themselves more to creativity and coming up with new and innovative solutions. I think that's probably more in private practice than in employed settings. I think most large hospital systems are set in their ways and they're not really interested in your opinions, although I think that varies greatly. I work for a small hospital system and they really value my opinion greatly. I'm really involved in decision making for the hospital and for my practice. So I think it really depends. It really depends. It also depends on the employees. Some employees want to be led and some really want to provide input.
Yeah, again, going back to practice settings, it almost seems like you can take the best of some of these different management styles and kind of create your own to mold it to the environment to optimize,
Absolutely. But to go back to the last question for a sec, I think that if you're going into a new practice, I think almost across the board, the wrong thing to do would be autocratic. I just don't think that in most practice environments, people take well to somebody new coming in, starting to give orders.
Right. Yeah, I think that's great advice. How about to more seasoned urologists that may be changing practice settings, going from private practice to an academic setting? How would you counsel that person to develop their management style?
Well, the first thing I would say is don't do anything immediately. take some time to get a feel of your new organization, how things work. You really, at the beginning, don't want to start stepping on toes. You want to have a good feeling of how things are done. And then you want to go in gently. If you have good ideas, everybody wants to have good ideas. But what I would say is, and this is contrast to how I feel I was when I started practice, I really was more of that authoritative type. And I would try to push my ideas down, to other people. But that doesn't go over well anymore. And, everything nowadays should be a discussion when appropriate and a give and take. And there's almost always a way to come up with a good middle ground with a good opinion. So I think if you go into it more like a negotiation, it works better.
Right. And I think that's really good advice, no matter what or how your practice setting is changing, whether you're going from academics to private practice or vice versa, or into an employed setting. I think it's really good advice to just go in, try to understand the environment, try to understand how the policies and procedures work in your new setting, and then bring your good ideas at the right time. So I think that's really good advice.
Well, and the other thing to consider is, especially for physicians in an employed setting, once you're in an employed setting, you do have a set of interests that are the same as your employer. You want the patients to have a good experience. You do want to provide quality care, but an employer or a hospital setting also wants to ensure that they're not losing money. They have a strong economic focus, whereas when you're an employee, your focus is more on patient care. And I think you also do care about the patient experience.
Great advice. How about suggestions for practice managers out there?
So this is an area so first of all physicians want to be involved in decisions that affect them and their patients. I don't think there are many physicians out there that take well to being told what to do. I think for managers, it's very important to involve physicians in the decisions and make physicians feel like they're a part of it. We don't want to feel like cogs in the wheel. And any organization that makes you feel like a cog in the wheel should rethink how they're doing things.
Yeah, great advice.
The hard part is that for many employed physicians now, especially those working for hospitals or academic centers, you don't have a true practice manager like private practices did in the past. Today, managers for many hospitals and academic centers are managing multiple different specialty clinics. They are managing the HR component, not necessarily the billing component, not necessarily the collections component. They may manage the day-to-day operations of your clinic, but the pieces are actually separated into many, many different people now. And so it's really a disjointed style of managing a practice.
What advice would you give? And we'll just start out with the residents that are getting ready to go out into their new setting. How would you advise them to interact with the practice manager?
So a practice manager can be your best friend and ally. So again, I would say go in, be respectful, listen, always listen. Really have a good sense of how your practice works and functions. Learn before you start throwing ideas out there. And when you do, always make it a collaborative situation.
Yeah, great advice. And I think that's for anybody going into any setting is, again, learn the environment and bring positive energy and, try to be respectful of the process.
The other thing is that, everything that you bring to a practice has to have a benefit. So if you can outline and list the benefits of any change that you want to make, I think it's much easier to have that put through. And that applies to whether you are suggesting a new piece of equipment, getting a new, another physician, another mid-level, anything that you want to do, if you can really have a list of the benefits of doing that, you're going to be much better off. It should never just be because you want it.
Right. And good advice for sure. Any other comments or about management styles or anything else that our listeners should know?
Well, yeah, there are other management styles out there. And again, I don't think anybody really conforms to just one style. But, there are other styles, such as there's a visionary style where the leader or the manager really has this creative overall vision for the organization. And that's what guides everything. It really encourages out of the box thinking. It can change at a moment's notice. This, can be very inspirational to a lot of people, as long as the employees really buy into the culture of the organization. But if they don't, then it doesn't go over as well.
Excellent point. Any other closing remarks?
Closing remarks, I would really just say, before you join an organization, get a good feel of the style of management that they provide, because it really has to fit with your personality. If you just want to go in and do your job and not be involved in day-to-day decision-making or vision for your organization, then you might want a place that has a more autocratic or paternalistic style of management. But if you're the kind of person that really wants to get involved, you want to make sure that you're an organization that has a more democratic style of management that's going to involve you.
Would you say that let's just take that last example. If you're coming out of residency and you really are interested in being a decision maker in your group, would you say that there's more availability in the private practice setting versus an employed setting or an academic setting, or how would you kind of rank the hierarchy of that?
Truthfully, I think the larger the organization, the more difficult it is to get involved initially. But I think it's also very, very practice dependent, because there's small private practices out there where one person's been running it, him or herself, for years. And it's difficult when you've been doing that to have somebody new come in and make suggestions. And then there are organizations like the one that I belong to, which is a smaller, large organization, where they really do value people's opinions and make it very collaborative. I think it really is dependent, and you're just going to have to evaluate whichever practice or practice setting you're looking at to see if it fits with your style.
Dr. Berger, this has been very informative. Thank you for sharing your time and expertise with us today.
Well, thank you for having me.
And thank you to our audience for joining us on the AUA Leadership and Business Podcast.
Thank you for listening to the Leadership and Business Podcast. We invite you to discover the full range of leadership and business programs offered through the AUA Institute for Leadership and Business. Simply visit auanet.org and navigate to the Leadership and Business tab to learn more.